Now, for the latest on coronavirus in South Africa, I'm joined via Skype by the head of internal medicine at the University of KwaZulu-Natal, Professor Bulie Magula. Professor, a very good evening to you. Thank you so much for joining us and a Happy New Year.
Good evening, Simphiwe. Happy New Year to you and good evening to the viewers.
Let's start with the surge of coronavirus cases in South Africa, particularly in the KwaZulu-Natal province. As a healthcare worker yourself, who is in the front line of the fight against coronavirus, what do you see on a daily basis?
Simphiwe, I actually need a box of tissues to answer the question that you're asking. It's hard. It's really, really hard. We're seeing patients coming into hospital critically ill. The main manifestation of this disease is a lack of oxygen saturation in the lungs, which means that the body can't get the oxygen that it needs to for the organs to work. And this is what we are seeing on a daily basis. With normal saturation is between 92 up to 100%. We're getting patients coming in with oxygen saturations in the 50s, even lower, and we're battling to really save them. We're losing a lot of patients. We're losing young patients. We're losing patients of all ages. It's been the community in general, and more, we're losing the very health workers that we need. Most of our patients at the current time are our very own nurses and doctors and other healthcare workers. It is painful. It's really, really hard. We're losing them in our hands, but we're doing the best that we can.
Professor, I know it may sound like a rhetoric question, but what really gives you the strength to move on and carry on your work under the circumstances and in some instances with the almost non-existent PPEs?
It is the very thing that made one want to get into the healthcare system to save lives. That is what drives me and a lot of people that I work with every day. I've been on call 24/7. I can't even remember now the last time I have not been, on call and not have to go out. From this very long weekend, New Year's Day, I've been working around the clock. And that is what other people are doing as well. We do have a PPE, we have adequate supplies of PPE, but even oxygen supply is becoming a problem. Access to beds for patients is becoming a problem because there's just so many people that are sick. So to go back to your question, what helps me to wake up every day with a passion to go back and do what we have to do is the very calling that called me into medicine.
Now, Health Minister Dr Zweli Mkhize, in an online conference earlier on, mentioned that healthcare workers will be first to receive this particular coronavirus vaccine. Are you at all anticipating this?
Well, I was hearing in the news clip that you played just now. It is a something that when we hear it now, we have to hope that it will happen. But as a clinician, I'm very much a strong believer in the biomedical approach first and foremost. So yes, we need the vaccine, and it gives us hope that it will come. But the non-biomedical approach, which is the prevention that we've been talking about all along, we must still hold on to those because we have to be alive. Everybody has to be alive to get that vaccine. And right now, the scores of people that we are losing before we get the vaccine actually reminds us of the importance of making sure that we don't acquire this infection and we stay, safe and do the very things that have been advocated all along. Because the vaccine, when it comes, it has to find us alive for us to be able to benefit from it.
And Minister Mkhize also acknowledged that, the herd immunity via a vaccine is the only way to beat coronavirus. So in layman's terms and in simpler terms, do simplify for us what herd immunity is and what it entails.
So the virus basically has to hit a dead end for us to beat it. And right now, because it's able to transmit itself from person to person. If one person gets the infection and transmits it to the next person, that propagates, it basically allows the virus to continue spreading in the way that it is and then causing the damage that it's causing. At the current time, we reliant on the prevention measures that have been talked about all along, the hand washing and the social distancing and so on, to be that barrier and the factors that will give the virus a dead end. But because we are not succeeding, the virus is continuing to spread. Now, if with those measures not being successful, we then need a vaccine so that we build up immunity in the community so that when the virus does infect people, it then hits a dead end and it's not able to transmit to the next person. So you need at least about 60–70% of the population to be immune from the virus for this immunity to be effective and the virus not to spread in the community. So that's the herd immunity that the vaccine will give us, because it will kill, the virus will not be able to spread when people are exposed to the virus, and it will then terminate the transmission from the one person to the next person. So you do need a good good number of people in the community to be vaccinated. There are challenges associated with that, because you do need people to accept the vaccine for it to get to that level of community protection.
There are various myths that have been thrown around with regards to this coronavirus vaccine. And, one of the myths, which of course still hasn't been proven, is that certain vaccines work it works differently in different demographics and in different racial groups. And, other myths, which of course still haven't been proven, is that it has got religious connotations. So do you get a sense that people, especially in South Africa, will be receptive to vaccines when they eventually hit our shores?
The religious connotation bit is the one that is very, very difficult to prove. And I think we'll just have to accept that and leave it at that. It would be very difficult to prove or disprove the religious connotations. The one about the demographics is that much easier to deal with, because before vaccines can be rolled out, it goes through various stages of testing. And once it's gone through and passed the laboratory phase of testing, and then it's then used in people, it's also tested in a phased approach. It then becomes important that if you want to use that vaccine in your own population, that you have the vaccine tested also in your population, because then that demographics, the disease profile, all other factors that you have in your population, the vaccine has been tested in your population. So that is one way of actually scientifically testing whether the vaccine works in that particular demographic. But it does not necessarily just have to be in your country. It's important. So it's also important that we become open to these scientific interventions, so that when when you have an outcome of a vaccine that works, you know that your population has also been tested, or rather has participated in that scientific venture, so that you're more confident that when it's rolled out, that your demographic, your disease profile, and so on has been tested, and we've seen whatever the problems or successes they may be with that particular vaccine.
So can a COVID-19 vaccine change anyone's genetic makeup? I mean, can it really change one's DNA?
So I guess those are some of the myths that one is trying to stay clear of. A simple answer that I would give is probably not, but I would actually prefer to stay clear of that conversation.
Okay. All right, Professor, great chatting to you. Thank you so much for your time.
Thank you. Thank you, Simphiwe. Thank you to the viewers too.
Indeed. That was the head of internal medicine at the University of KwaZulu-Natal, Professor Bulie Magula.